Thanks very much, Will. Good morning. Thank you for joining us on the call this morning. Just a couple of things that I wanted to highlight before we open everything up for any questions that you might have. So obviously, over the last number of days, people across Ontario have continued to see that Doug Ford has lost control of dealing with the third wave and the vaccine rollout. In particular, it's been absolutely shocking to know how many thousands of appointments for vaccines have been canceled, in particular in places like Scarborough and other hotspots where the need is so urgent because so many Ontarians are so vulnerable at this point in time. And lots of questions are being raised by opposition parties, by those outside with public health expertise, by municipal leaders about exactly what has gone wrong with the way that Doug Ford has lost control of the vaccine rollout. And so today, Ontario Liberals will be writing to the Auditor General to ask that her office do a full examination, a comprehensive review and analysis of the vaccine rollout that has been prepared by Doug Ford and his team. I know, of course, that the NDP sent a letter to the Auditor General yesterday, calling on her and her office to look into the specifics around the postal codes and whether or not politics entered into the decision-making process. I support the NDP's call of the Auditor General to look into that, but I want us to broaden, or I want the request to the Auditor General to be broadened. I don't want it to just look at the postal code issue, though that does have merit and should be examined closely. I want a full comprehensive review and analysis about how this plan was put together. I think the people of Ontario are owed that kind of transparency. I want to know if any particular companies or consultants, for example, were retained to help with this. I want to know exactly what the process looked like from start to finish, because I believe it is so important for us to learn from our mistakes. And it is clear, as I said at the outset today, Doug Ford is completely error prone on the vaccine rollout, that we're seeing thousands of cancellations. We're seeing people confused by the, as the government calls it, the multiple pathways, the confusing, tangled multiple pathways to try to get a vaccine. It's not good enough for the people of Ontario. I don't want this to ever happen again with any other approach that might ever have to be taken with respect to dealing with a crisis like this. And so that's why Ontario Liberals will request that the Auditor General go just a little bit broader than the NDP request regarding the postal code issue, to take a comprehensive look and examination, and of course report publicly on that relating to the vaccine rollout. The second thing I want to mention this morning is that we've started to see lots of media leaks about the notion of the updated modeling, which I gather this morning the people of Ontario will hear more about perhaps later today, or perhaps more likely tomorrow. I think there's a cabinet meeting taking place today. There's a lot of confusion even about how Doug Ford is handling this critical moment. So I'm urging Doug Ford to reach out to all three of the opposition leaders, myself, Ms. Horvath, and Mr. Schreiner, to provide us with a briefing as he's going through the deliberations with cabinet, with his science table. It's been a number of months since the opposition leaders as a group had the chance to meet with Doug Ford and his team. And I think at this critical stage, it is long overdue. So again, I'm urging Doug Ford, take advantage of the Team Ontario approach that we've all talked about in the past. Invite the opposition leaders in for a briefing so we can provide our, frankly, our constructive advice, our collaborative advice, and make sure that we are truly focusing on being in all of this together. And with that, I'd be happy to take any questions that you might have.
Okay, just a reminder to raise your hand using the Zoom function or write to the chat if you have a question. The first question is Ian Sheriff Scott from iPolitics.
Hi, Stephen. Good morning.
Morning, Ian.
So do you think that if opposition parties had been, involved in the rollout, I'm thinking back, to, I think it was January, I guess, when there was the Liberal motion passed about cooperation on the rollout. Do you think if there was a, true opposition involvement, that maybe, we would be in a different place today? Or, what are your thoughts on that?
Well, so my instinct tells me that there's a very good possibility, especially if Doug Ford had in a very authentic way, being willing to listen to opposition leaders. I'm glad that you pointed out that Ontario Liberals, through John Fraser's motion, brought forward the concept of a collaborative approach and lots of transparent reporting and having the infrastructure in place and being very clear, like right from the outset. It's very disappointing to me that that motion passed unanimously in the House months ago, and yet we find ourselves in this deeply distressing time as a province. I will only speak for myself. I don't pretend to have all the answers, and I am not an expert, of course, in public health. What I do know, though, is how government works. My 4 years serving in a couple of senior cabinet positions, I think, gives me a degree of experience that I will say a number of the people serving around Doug Ford might not have to the same extent. I'm also part of a team with a caucus that includes a former premier and other senior cabinet ministers. And so we would have wanted, as Ontario Liberals, of course, we have a job to hold the premier and his government to account, but there's a far larger responsibility that we all have as leaders to try to help Ontarians who are scared right now navigate through the rest of this crisis. And so from my perspective, it would have been in that spirit that I would have wanted to, and I still want to, work with Doug Ford and his team to provide the advice. But it takes two to tango, as the saying goes. It's one thing for Doug Ford to agree to a meeting, and I sincerely hope that he will give us a briefing on this, where we find ourselves today, but you have to be willing to listen to the advice. And so it's never the wrong time to do the right thing, as I and others like to say. And so I'm urging Doug Ford to put the call out, brief the opposition leaders. I'll come to the table with my best ideas in the hopes of collaborating at this critically important time for the people of Ontario.
Follow up?
Yeah, thanks so much for that. And so Minister Jones said yesterday, when asked about the the kind of multi-pathway approach to vaccinations, that this was like intentional, that the government meant to have these several pathways. So and of course now we're seeing things like this Twitter account that is aggregating all of these pathways, etc.
Right.
What is your view on this, and why do you think the government chose to go this route and not have a centralized system for everything?
Well, listen, I think that, it speaks to, and I've used this language before, and it's the only way that I can think of to describe the situation that we're in. I think that, and this is one of the reasons I want the Auditor General to take a deeper dive into this. And I know that her analysis and report will take a bit of time to put together, should she decide to do this investigation that we, and frankly, the NDP are asking for. But it's so important for us to figure out exactly how it was possible in this moment for there to be this degree of willful negligence, willful incompetence on the part of this current government. I don't know any everyday Ontarian who would have sat back in January and figured, look, the best way for me and my family to get the vaccine quickly is to make sure that it's as confusing a mess as possible, and that there's as much chaos and as many cancellations as you can possibly put together. And, maybe somebody deep in the bowels of this government, Doug Ford's office or government, thought this notion of multiple pathways made sense. I find that really hard to believe, having served in cabinet. But if that's the case, I think that that's the kind of, again, negligence that is just not acceptable. And frankly, in the last 24, 48 hours, it's really felt to me like the multiple pathways rhetoric coming from the minister and from Doug Ford and others is an after the fact rationalization. It sounds like a little bit of political spin to me. And the bottom line is, it doesn't have to be this way. I mean, aside from the fact that it should have been a one-stop shop from the very beginning and a centralized portal that was ready to go, all they should be doing at this point in time is acknowledging that they screwed this up and that they made a mistake, and that they're going to go back to the drawing board quickly, and they're going to fix it. But yet they double down and they triple down, and then they blame you and I. Anyway, it's completely inexcusable to me, and it's got to change.
All right, next question is Colin DeMello from CTV Toronto.
Good morning, Mr. Del Duca. I'm curious about what you think the government should be doing. It seems like they're considering a raft of new measures. A lot of people are wondering what more could they do. I'm wondering what measures you think they should go, and really how far should they go? Should it go as far as imposing a curfew on the people of Ontario and closing additional sectors of the economy?
Excuse me. Sorry, Colin. So let's be really clear about this at this point in time, based only on the speculation that I've seen on social media relating to some leaks that were coming out last night, and I think again this morning. It is very, very clear that Doug Ford has completely lost control of dealing with this third wave and also the vaccine rollout. And the reason I say it's completely clear is that it's only been a week since Doug Ford, about a week since Doug Ford made the first announcement, give or take, since the first announcement about additional measures, then a second announcement about a stay-at-home order, and then another announcement about schools closing. And now we're hearing the modeling is sort of out of control, potentially. We're hearing rumors about this. And so people are scared. I get the impression Doug Ford is probably scared. His team is probably scared. The people of Ontario are scared. I talked to a personal friend this morning, and that's the really shocking thing, I guess, or crazy thing, scary thing about the third wave. So many of us know people in our own orbits, higher numbers than the first wave by far, the second wave, who are coming down with positive cases of COVID because of these variants of concern. And because this government, led by Doug Ford, were not ready to deal with this. So I just want to say right up front, Doug Ford has clearly lost control. As for the additional measures that should come forward, this is one of the reasons I'm asking for Ford to reach out to the opposition leaders to give us a briefing. Because like you and like many people across this province, I'm confused and I'm flying blind. And I don't, yes, I have a job to do to hold Doug Ford to account, but we all have, those of us who lead in this province have a far greater mandate and responsibility to the people to help them get through this kind of crisis. And so, look, I want to be helpful and I want to be collaborative and I want to be constructive. But right now, Doug Ford's not asking me or the other two opposition leaders or our respective caucuses for any kind of support or help. So I'd like to have a fuller picture of exactly what the scenarios are before I say specifically what I think should take place. Having said that, if the rumors are true that the projections are starting to skyrocket, because Doug Ford's lost control, then I think, like I've said all the way through, every option should be on the table. And if there's advice coming from the women and men serving on the science table, I think that has to be reported out to us publicly. We are long past the point where Doug Ford can afford on our behalf to play this game that he claims he's listening to the science table. It's evident he's not listening to the science table. Dr. Williams is kind of stuck in the middle of this whole thing. Just come clean. That's all Doug Ford has to do. Come clean, let all of us know, in particular the opposition leaders, where things stand. And then let's take a look at all the options that are on the table, because we need to find a way to get through this. Simultaneously, he needs to fix the vaccine rollout. He needs to come up with a real plan and a one-stop shop, a centralized portal run by the government of Ontario that eliminates the confusion and gets those 1 million doses of vaccines out of his fridges and into people's arms.
Follow up.
Thank you. If I can ask about the potential of a curfew, this is something that has been under consideration or has been presented to cabinet, for multiple months now, ever since January, and they've kind of shied away from that. And the stay-at-home order worked in January. I'm wondering, given what we're seeing happening in Montreal, would a curfew be an appropriate action for them to take here, or would it, would it be wise for them to kind of look at that scenario there and say, maybe that would be pouring gasoline on this fire and maybe we should avoid any kind of curfew?
Yeah, so again, the curfew as a discussion, and when I say everything should be on the table, I believe that includes the curfew conversation. And I think if the women and men who have the expertise, who are at the science table, are looking at the numbers and they're looking at the way the virus is spreading, and they're looking at the vaccine rollout, which has been completely mishandled by Doug Ford. And they are concerned. And Doug Ford is scared, because it's obvious he's scared at this point in time. I think everything should be on the table. And if they're saying the best way to deal with this is to take into account things like closing down temporarily certain parts of the economy, introducing a curfew, dealing with some other circumstances that we still have, because there is a lot of confusion out there still, then I think that's what we should be listening to. I understand politicians and leaders are elected to lead, but we are now in what sounds to me like a very difficult moment, perhaps the most difficult moment. And it's really distressing for the people of Ontario, because we can all see the finish line. We know that the vaccines are coming. They're here. Over 1 million that are sitting in freezers today, more coming, millions of more coming. So we can see the light at the end of the tunnel, as the saying goes. And that's sometimes when things start to slip, but the slipping is what's actually making people sick. And in some cases, tragically, people dying and overwhelming our healthcare system. So I think everything should be on the table. And at this point in time, the best advice coming from that science table, which is provided, I hope, to the people of Ontario broadly, not just to one little tiny group around Doug Ford, is the guidance that I would want to follow at this point in time.
All right, there are no further questions on the line. Thank you.
Thanks, everyone.